Hello. Hey there. I am Nicole Calloway Rankins. I'm a board certified OB GYN physician and certified integrative health coach. I am just waiting for a thumbs up from my assistant that you can hear me and see me okay. So let me check and see if she can hear me and see me okay, and then we will get started. All right. Okay, so thank you for being here. Like I said, I am Nicole Calloway Rankins, board certified OB GYN physician and certified integrative health coach. And today I'm just going to talk to you just for a few minutes, about 10 minutes, on some tips for how to prepare for the hospital. Now, I have a free downloadable checklist you can grab. You can go to ncrcoaching.com /hospital tip sheet. Again, that's ncrcoaching.com /hospital tip sheet. That link should be in the description of the video. If it's not, I'll be sure it's there during the replay. All right, so just a quick snapshot of what I'm going to cover. I'll talk about some logistical things you need to know, what to do for when you're in labor, for after the baby's born, for going home, a few tips for your partner, what not to bring, and then finally, prepping it down there. Now, forgive me for using toddler language, but the Facebook police get a little antsy when you use anatomically correct names of body parts, so I have to be a little bit careful. Okay, so let's jump right in. First, I'm going to talk about a couple of important logistic things you need to know. So, first up, you want to register ahead of time before you get to the hospital so that all of your information is in the computer and they can easily pull it up when you get there. The last thing you want to do while you're in the middle of a contraction is having somebody ask you, what is your zip code? So register ahead of time at the hospital. A lot of hospitals let you do that online now, so check if that's an option for you. The other thing you want to do as far as logistics is you want to do a dry run of where to park and where to go in the hospital. You never know when your labor is going to start, and you don't want it to be 11 o'clock at night and you're trying to figure out, where do I go, where do I park, any of that kind of stuff. So do a dry run of where to park and where to go. Now, if you take a tour of the labor and delivery unit ahead of time, they'll go over that stuff. And I do recommend that you do a tour. But if for some reason you don't, then take it upon yourself to figure out where to park, where to go. You'll be definitely glad that you did. All right, so let's talk about some things to do to prepare for when you're actually in labor. Now, the first thing I want you to do is make sure you know your GBS status. GBS stands for group beta streptococcus. It's a bacteria. Now, women, we all have bacteria in our vaginas, but this one particular bacteria can, in rare circumstances, make a baby very sick. So we test all pregnant women for it between 35 and 37 weeks. And if you have the bacteria, and about 30 to 40% of pregnant women carry this bacteria, you'll need to get antibiotics through your IV while you're in labor. So know your GBS status going into birth. The other thing you want to do is have a couple copies of your birth plan or your birth wishes so you can give it to the nursing staff and to whatever doctor that's there. Now, in about 3 weeks, I am going to be doing a live webinar on how to make your birth plan. I am super excited about it. It's going to be tons of information in there, so stay tuned for that. All right, next up, you want to think about some comfort items for your labor room. Your labor room should be a warm, welcoming, comfortable environment. So bring some music if you want to. Bring pictures that may help you during your labor. If you have a favorite blanket, then bring that. Just be careful that you don't bring anything that you would get upset if it gets blood or bodily fluids on it, because there's a lot of that in labor and birth. The other thing you can bring is white Christmas lights. I think they create a great environment in the room. You just kind of string them around the room. I think hospital lights, those bright, harsh lights, just don't, I don't know, that's not a great environment for a baby to come into. I think white Christmas lights, and that's a tip I learned from the midwives I work with, they create a nice, calm, welcoming environment in the room. So consider doing that. All right, now if you plan to do an unmedicated birth or natural birth, for sure bring some comfortable shoes, because you're going to be up, moving around, walking in the halls, moving in your room. So bring some comfortable shoes that you can get in and out of quickly, like some slippers, for instance. Also, bring some flip flops if you plan to get in the shower to help with pain management, to use water to help with pain management. Bring just some cheap throwaway flip flops to wear in the shower. Now, I know that the hospital cleans the shower, but I don't know. I have a thing about like my feet and touching the ground in public spaces like that. So just bring some nice, cheap throwaway flip flops that you can wear in the shower. And you can also wear those in the shower after delivery if you want to. All right, now speaking of the tub and the shower, you also want to bring like a bikini top or a sports bra top. Those are things that'll help you be comfortable while you're in the tub or shower. And your partner can also bring swimwear so they can get in the tub or shower with you. Okay, now the last thing I'll say is, as far as what you need for while you're in labor, is if you plan to get an epidural or if you're going to be induced, then you may want to bring some things to occupy your time. Because in those circumstances, there may just be kind of a lot of downtime where you're waiting. So if you have a movie that you wanted to catch up on or a book you wanted to read, bring that stuff with you so you can have something to occupy your time while you're waiting for your baby to be born. Okay. All right. So let's move on and talk about things to bring for after the baby is born. Now, for sure, you want to bring your own toiletries, like your own toothbrush, toothpaste, your hair stuff, your deodorant, your lotion. Yes, the hospital may provide some of that stuff, but you feel so much better, so much more like yourself and more comfortable when you have your own stuff. So just pack a nice little toiletries bag. The other thing you want to do is bring some comfortable clothes to wear, including sleepwear. Now, yes, you can wear a hospital gown, and that's fine if you want to do that. But I really feel like wearing your own comfy clothes just helps you feel more like yourself and helps it like take out the medical aspect of birth, because birth actually isn't a medical procedure. So bring some nice, comfortable clothes to just lounge in while you're in the hospital. Just be sure things open from the front so that you can easily nurse. And like nursing bras, nursing tops work great for that. Okay, now, other thing you want to bring, you gotta have like big, loose, comfortable underwear, like old fashioned granny panties. You can use the hospital mesh underwear if you want to, they work great for that. Those things are ugly as all get out, but my God, they are the most comfortable things in the world after you have a baby. I might still have a pair upstairs in my drawer. But anyway, if you don't want to wear those hospital granny mesh panties, then get yourself some big, loose, comfortable cotton underwear. You will not want to wear anything else after you have a baby. All right, now, of course, get a couple of outfits for the baby to wear while the baby's in the hospital, just a couple of onesies, socks, hats, that kind of thing. And for sure, you need to have some snacks while you're there. This is something that I think people forget a lot. You may get hungry at like 11 o'clock at night or 3 o'clock in the morning while you're up nursing or that kind of thing. And hospital cafeteria food is never great. The vending machines may have stuff. But definitely bring some snacks so you feel a little bit more comfortable while you're there. And if you don't want to bring snacks, then bring like some dollar bills or loose change or credit cards so you can use for the hospital vending machine. Now, one thing that I think you don't necessarily need to bring, I don't think you need to bring a nursing pillow like the boppy pillows. You can if you want to, but they're not 100% necessary, especially for this couple days while you're in the hospital. And it's a lot to carry. So if you don't want to bring your nursing pillow, you can skip that. You'll be just fine. All right. Now, going home, definitely have an outfit for you to wear going home and have an outfit for your baby to wear going home. I still have the outfits that I brought both of my girls home from in the hospital. So that's a nice kind of keepsake sort of thing. For sure, you'll have a car seat, but also have a blanket to put over the baby. You want to keep the baby warm and you want to keep people from touching your baby while you're going through the hospital on the way to the car. And then the last thing to bring is bring a bag that has some space in it, whether it's completely empty or some space for the extra stuff that you'll acquire while you're in the hospital. You're going to get like extra diapers and wipes and that kind of thing. So you want to have a bag to put that stuff in. Now, some things that you do not want to bring: do not bring a lot of jewelry, do not bring a lot of cash. You don't need to bring diapers. If you have medications that you take on a daily basis, the hospital will give you your regular medications, so don't worry about bringing your medications. And you also don't need to bring your breast pump unless you have some questions about how it works and want to touch bases with the lactation consultant. You really don't need to bring your breast pump while you're in the hospital. You're going to be putting your baby to your breast to nurse. And then for your partner should include their own little bag for the hospital, their own toiletries, change of clothes, including like swimwear if they want to get in the tub or shower with you. Now, they do need to bring their own medications if they have medications and some snacks and entertainment. So they need their own little separate bag for the hospital for themselves. All right, now the last thing I'm going to talk about before I hop off is prepping down there. Now, a lot of women get anxious about how they look and everything down there. And let me tell you, like as an OBGYN and your doctor, your midwife, we really don't care. We don't pay attention to how things look down there. I mean, it's just something that we see all the time. So don't feel like you have to wax. Don't feel like you have to shave or do anything special. You don't need to smell like flowers or fruit or perfume or anything like that. If you want to do anything, just be clean. Like that's all we ask, be clean. So take a shower if you can, a quick shower if you want to before you come in, or hit your T-zone. Like my mom used to say, the T-zone, get your underarm, that's the top of the T, and the middle part of the T, get your T-zone if you want to do that. But even if you don't have time to do that, you will be fine. So do not worry about doing any prep or anything special in that area. And then last thing, women used to get an enema, and this is like back in the day, even before I started practicing, almost 15 years ago. Women used to get an enema when they hit the door to the hospital. And that's because when you push during labor, you poop. You use the same muscles, and sometimes you poop. These days, we're like, it's okay, it's fine. You don't have to get an enema to flush anything out ahead of time. So don't think that you're going to get to the hospital and have to get an enema. Your mom or your grandma may say something like that happened to them, but we don't do that these days. If you want to, that's up to you, that's fine, but it's not something that you have to do. Okay, now that is it. If you want the handy tip sheet that I talked about, go to the link in the description of the video, or it's ncrcoaching.com/hospital tip sheet. And if you have any questions, then definitely leave them in the comments, and I will come back and answer all the comments on the video. So leave any questions that you have in the comment section, and I'll be sure to get back to you. Okay, that's it. I hope you found this helpful. I will see you next time. All right, bye.